So what is the fate of thin buccal bone in the premaxilla after tooth extraction, or even after raising a flap? Are we going to lose it all? Hi, I'm Dr. Fernando Verdugo, American Board Certified Periodontist since 2003, clinician, researcher, and published author. Both maxillary and mandibular anterior teeth present a fragile foundation. Over half of maxillary central incisors and canines have a buccal bone thickness less than 1 millimeter. Lateral incisors are no different. In this clinical scenario, when extracting an anterior tooth, we are to expect significant dimensional changes. It is common to expect significant volumetric changes, that is, shrinkage and collapse of the site where that tooth has been extracted 6 to 12 months after the tooth has been extracted. That volume loss will continue in time if nothing is done. Considering the fragile foundation of all anterior teeth, several techniques have been developed to compensate for such volume loss. Today, we're going to talk about the fate of that very thin buccal bone after tooth extraction and what we can do to compensate for such volume loss using the biologically sound principles of periosteal-guided bone regeneration. Human research data has shown that there's a normal physiologic process of remodeling after tooth extraction that in intact sockets comes about 1.1 millimeter of bone resorption volume loss after 1 year. This normal physiological process of bone remodeling is to be expected on intact sockets, that is, sockets that have no bone loss or buccal bone dehiscences. Now, when the buccal bone is thin, 1 millimeter or less, the volume loss can be up to 3 times greater. So, in other words, the volume changes on buccal bone areas with a thickness of 1 millimeter or less are up to 3 times greater. But when there's no buccal bone at all, that is, when there is a large buccal bone dehiscence, the dimensional changes, the volume loss to be expected is significantly higher. In these clinical scenarios, especially in the premaxilla, we have techniques to augment or prevent significant volume loss after tooth extraction. And that all starts with a gentle tooth extraction. We have recently saw that following the principles of periosteal-guided bone regeneration, after extracting teeth in the anterior maxilla with severe bone loss, that is buccal bone dehiscences of over 8 millimeters, we were able to maintain, preserve, and increase the bone volume and compensate for further dimensional changes when we apply the cortical seal technique, that is a shield of autogenous bone placed over the damage. We can actually modify the biotype of the individual from thin to thick by doing a 3D reconstruction of that damaged socket with tiny little seals of cortical bone. This can be done flapless or flap-mediated. We can do it delay or simultaneously at the same time of implant placement. We have recently published this more natural technique in scientific peer-reviewed journals such as the International Journal of Oral Maxillofacial Implants and Clinical Advances in Periodontology. Our CBCT data has shown that the average buccal bone thickness over those implant sites was about 2 to 2.5 millimeters, which is quite good. This more natural technique reduces cost, morbidity, and treatment duration, eliminating the need of multi-stage protocols. Following the principles of periosteal-guided bone regeneration with the cortical seal technique, we can achieve natural, long-lasting aesthetic results with ideal pink aesthetics. So bottom line, we don't have to lose it all. Whether we raise a flap or we do it flapless, if the tooth extraction is done with care, we are to expect minimal volume changes after tooth extraction in the anterior maxilla. Furthermore, we can regenerate those sockets that are severely damaged by providing a new cortical plate to that site that presented a significant dehiscence or buccal bone loss. If you find this information interesting, please don't forget to subscribe. Bottom line, not only we can preserve thin buccal bone after extracting a tooth, we can increase its thickness, we can regenerate lack of buccal bone, and using the cortical seal technique, we can create an environment conducive to stable buccal bone long term that will provide stable and long-lasting clinical outcomes.